I get a lot of patients that come to see me for a second opinion. Many times when a woman has a certain issue that has already been diagnosed, for example, a fibroid uterus or pelvic pain and things of that nature, a lot of gynecologists will recommend doing a hysterectomy. Hysterectomies come in 4 flavors, if you will. You can have a transabdominal hysterectomy, which is a C-section type incision. It's an incision about 10, 12 centimeters in size, and it's done in the lower area of the abdomen. And certainly there is some indications to do these kind of surgeries. The other type of hysterectomy is something called a vaginal hysterectomy, where this hysterectomy is done, everything about the hysterectomy is done usually through the vagina. And this usually is a little bit better for the patient because recuperation time is significantly lower, there's no scarring. And then the other 2 are kind of a combination. One of them is called the laparoscopic hysterectomy, where everything is done through the laparoscope. Many women, when presented with this option, will pick this option because most of us would rather have 3, 4, or even 5 very small 1 centimeter incisions or less instead of having one large 10 to 12 centimeter incision. And then the last form is what's called the laparoscopic assisted vaginal hysterectomy. Most of the hysterectomies that I do them with this type of technique, where it's a combined approach with a laparoscope, the camera that goes around the belly button, with maybe 1 or 2 other small incisions, along with the vaginal portion of the hysterectomy. The huge advantage of this is that recuperation time is very brief compared to doing a transabdominal hysterectomy or the large incision. I find that a lot of the patients that come see me when presented with these options will choose the LAVH, and in the vast majority of times we're able to do this. There are cases, however, where you're not able to do it or it's not safe to do it that way. And if that's the case, well, then we will counsel appropriately. I've been a physician since 2001, and my area of specialty is obstetrics and gynecology. And what that means is that it covers the full gamut from the early teen years of women all the way through postmenopausal stages, including pregnancy.